Hey guys, it's Derek Xie, physical therapist. In today's video, I'm going to be talking about something called frozen shoulder or adhesive capsulitis and whether that is something that's contributing to your shoulder pain or not. This information that I'm going to be pulling from, it's going to be from the clinical practice guideline for adhesive capsulitis from the Journal of Orthopedics and Sports Physical Therapy. I will put this in the description below for your reference later on. Adhesive capsulitis or frozen shoulder is a painful condition that stems from inflammatory reaction in multiple regions of the shoulder. Sometimes it's consistent with what we call synovitis, and synovitis is inflammation of the synovium. The synovium now is what lines the inside of your shoulder joint, and when that gets inflamed, that can be a source of your pain. Not only is frozen shoulder painful, but it's usually accompanied by the capsule that's around the shoulder joint, which is made up of all the ligaments. They tend to get thicker and they tend to get stiff. And then as a result, there's significant restrictions in range of motion, which then prevents you from lifting your arm up over your head or kind of getting up behind your head. One of the most restricted range of motion for frozen shoulder is what we call external rotation, which is when the shoulder goes out like this. And functionally, this is usually presented when people try to reach behind their head because you need external rotation to get up behind your head. So these are the risk factors associated with frozen shoulder. One, if you have diabetes or a thyroid disease. Two, it's more prevalent in females between the ages of 40 and 65. And three, if you had frozen shoulder on the other side before. If you have these things, these are what predisposes you to having this painful condition in your shoulder. When it comes to frozen shoulder, there's usually 4 stages that's listed in the literature. I'll simplify the key points for you here. Stage 1 can last anywhere between 1 to 3 months according to the guidelines. This is usually associated with pain at end ranges of motion. If you're trying to reach the arm up all the way high up and there's a little bit of sharp pains there. That's usually also associated with pain at rest, a little bit achy in the shoulder. There's some sleep disturbance at night. This is something that I've seen clinically in the clinic where it presents itself just like shoulder impingement. So this often gets misdiagnosed and later on it becomes adhesive capsulitis because we try to treat it as shoulder impingement, try to do some rotator cuff strengthening, doing some range of motion, and then it doesn't get any better because it progresses to stage 2. Usually the hallmark sign for this initially is when they have a loss of external rotation in the beginning compared to the other side. So meaning if you're having a whole lot of pain on going into this motion, reaching up, trying to scratch the back of your head, if you're doing it trying to compare to the other side and you have a significant loss of motion going that way, that's usually one sign that I look for. That's also something that's stated in the guidelines as well. Stage 2 can last anywhere between 3 months to 9 months. This stage is also called the painful or the freezing stage. This is usually accompanied by a gradual loss of range of motion, and people tend to have more pain here than stiffness. This is also where you start to lose range in multiple planes, kind of like what I was saying before. So all the planes of the shoulder is flexion, when you bring your arm up forward, abduction, your ability to bring the arm up to the side, internal rotation, just turning the arm in, external rotation, horizontal adduction, and horizontal abduction. That is all the planes of the shoulder joint and how it is allowed to move. That's essentially the function of the shoulder. And the combinations of those motions allow you to scratch your head, reach up behind your back. Stage 3 can last between 9 to 15 months, and this is also known as the frozen stage. It's called the frozen stage mainly because there's usually less pain when people are in this stage, but there's way more stiffness. This is when the shoulder is barely able to move and it's very tight when you're trying to stretch it. Most people, when I try to stretch it, the end feel that I get, it feels like a belt when I'm pulling on a belt. So the last stage, stage 4, is called the thawing stage. This can vary anywhere from between 15 to 24 months, depending on where you're at. This is where your pain is a little bit lower, it's starting to resolve, the pain's starting to go away from the shoulder, but there's still a significant amount of stiffness left. This is honestly the stage where I push my patients the most. This is the stage where you're supposed to be, based on the guideline, you want to be stretching to end range, if not a little bit more, and kind of adding a little bit of overpressure at the end to be able to get that shoulder to stretch as much as you can. So there are diagnostic classifications stated in the clinical practice guideline to help clinicians determine whether the patient that's in front of them with shoulder pain have frozen shoulder. These are actually things that I personally use to help me determine whether the person in front of me, when I'm treating them, have frozen shoulder, so I can treat it appropriately and help them manage it, and then thus help them get better on the long run. So I consider their risk factors first. They're basically their profile. So meaning one, their age, some of the things that I talked about at first, whether they're between the ages of 40 to 65 years old, whether they are female, and whether they have a history of diabetes or thyroid disease. And lastly, whether they had frozen shoulder on the other side before. So next, I kind of go into the history in terms of the story of what they're telling me about their shoulder. I'm usually looking for things like the shoulder's progressively getting worse along with pain and stiffness. The pain and stiffness that they're experiencing is also limiting their overall functional activities, meaning they're having trouble reaching up overhead, lifting things, dressing, reaching behind their back, reaching behind their head to kind of scratch their head, grooming activities, anything that kind of relates to the use of the shoulder. After I finish talking to the patient, what I usually do after that is actually have them lay on the table, and then I move their shoulder around and I feel for things to see what it's actually feeling like. What I'm actually looking for, if I'm thinking it's frozen shoulder, is whether their passive motion meaning they are as relaxed as possible and I am moving the arm for them, if that in itself feels tight, compared to when they move it themselves actively, meaning if they move the arm with the muscles of the shoulder. Usually, if they're active, is similar to their passive, meaning if I have them move it, if they can move it about right here, and then I help them move it, and I move the arm, and it kind of stops about right here, as well too as a result of pain or stiffness, then that's another sign that I kind of look for to kind of help me with the diagnosis. As I'm looking through their motion, what I'm typically looking for is a significant restriction in external rotation, because that is one of the hallmark signs for frozen shoulder. So a lot of the times it's actually restricted about 50% or more, and they have pain. So if I look at their uninvolved side, meaning the side that's not hurting, if I'm kind of passively bringing them out into external rotation, there's usually minimal restriction. I'm able to go all the way to the end of what the shoulder allows me to do, versus if I'm doing it on the involved side, usually what happens is it stops about halfway, if not more. And it's usually stopped by one, the patient, because it hurts and they're guarding against me, which is completely understandable, or two, the shoulder is so tight, that is really what I can get. That's the restriction from the frozen shoulder. Now, as I'm moving them through motion, one of the things I'm also looking for is what they're telling me as I'm moving through the range. Is it provoking the pain that they are basically telling me about? If that is the case, that is another sign that I add to strengthen my diagnosis. So what I mean by that is, if initially they're telling me the shoulder pain is achy, it's sore, it's throbby, it's sharp, or whatever combination that they're telling me about of how the shoulder feels like, when I move it and I'm able to provoke that same achy, sore, throbby, sharp, then that's another thing that kind of helps me strengthen it. The last thing that I actually look at while they're still on their table is how the shoulder joint moves in relation to the socket. So the shoulder joint, let me grab a model over here. So the shoulder joint is a complex of a ball and a socket, essentially. So this is the humerus, this is the scapula, this is right here, your collarbone. This is the right shoulder. So this is what it theoretically looks like. What I usually do is I take the ball and I try to move it back and forth to try to see whether it actually moves. If it's truly frozen shoulder, then it should be significantly restricted because of all the joint restrictions, the connective tissue, the capsule that's around the joint itself, that's all made out of the ligaments. And then I go on to the other side and I try to move it back and forth, and it moves relatively with ease compared to the side that it hurts. And that's another thing that kind of helps me strengthen my diagnosis. So those are all the variables that's encompassing frozen shoulder. So if you have a lot of these variables that apply to you, I highly recommend you to check out your local physical therapist or your doctor just so you can get that treated appropriately. On the other hand though, if you only have like 1 or 2 of these variables, this video about frozen shoulder may not even apply to you for why the cause of your shoulder is hurting. There could be multiple causes for why your shoulder is hurting. It could be related to your rotator cuff, it could be related to your labrum, it could be coming from your neck, it could be coming from your mid-back, or it could be related to your ribs. There's so many things that can happen. I hope all this information was helpful from the practice guideline to use as a guide. If you enjoyed this content, please leave a like and subscribe. If you have any questions, please leave it in the comment section below. Remember, if you want to reference additional information about the practice guideline, I'll leave that in the description below as well. I'll see you guys in the next video.